Dr. Kudzanai Muzenda is the president of the Zimbabwe Hospital Doctors Association, and he joins us now via Zoom from Harare. Thanks so much indeed for joining us. Welcome to the program. Your reflections on this new piece of legislation?
Good evening, sir. Well, obviously, this is a draconian law which has been passed into bill and is oppressive to the health workers, and it does more harm than good to the healthcare system, because the problems that have made us reach into this situation are still there and will always be there, and will cause health workers to end up deciding to leave the country to seek greener pastures where they are more appreciated. So you realize that we as Zimbabweans, as healthcare workers in Zimbabwe, we have a myriad of challenges that we have been facing, which include and are not limited to poor remuneration, stalling of career development, which also include that is retention of letters of good standing, and also depleted and dispirited workforce, and also the inability of health workers to give adequate and effective healthcare service due to lack of resources, lack of sunrise.
How have the authorities explained to you this legislation? Why have they felt that it's necessary? It seems as if they're labeling you as essential workers, and essential workers normally aren't allowed to strike.
Well, obviously, healthcare workers are a critical component of the civilians and the majority of the population, because we offer skill sets that is life-saving, potentially life-saving. So you realize that, well, these bills were given to us for us to air our views, and we rightfully repelled against these bills, but somehow it was passed into law. It got through parliament, got passed through parliament, and was passed into law. But however, you find that the things that are premised on the doctoring of this bill are that healthcare workers are unpatriotic and are selfish, which is rather not true. The cause of the protracted job action is because government will be unwilling to sit at the table with us and hear our issues and address them adequately. So you find that at the end of the day, you have a situation where you would do more harm to the patient than good if you keep quiet and maintain the status quo that is prevailing at the time. And hence, in such times, we have to stand up and lay out as it is that we are unable to continue due to lack of resources and equipment and poor remuneration and those many other things. We as the health workers, we develop a relationship with our patients. It is disheartening for me to wake up tomorrow and tell my patient that I'm not able to dress you because you have no betadine, and the hospital has run out of betadine. You can imagine that.
Yeah. Let's talk a little bit more about the conditions that you find yourselves in. Let's start with remuneration, because I believe as many as 4,000 doctors and nurses left Zimbabwe in 2021, which is unsustainable. What kind of pay are state nurses and doctors getting paid? Let's start with nurses. Average salary for a nurse in Zimbabwe?
Well, I'm not sure about the nurses' salaries, but well, we are nearly pegged around the same with nurses. But as a junior doctor, at a central institution, you would get something around $200 and somewhere around 350,000 RTGS, which would be at the prevailing exchange rates, which would be equivalent to something like 310, 320 US. So
All right.
somewhere around 500 would be the maximum going downwards.
All right. So a doctor who studies for 6 years, 5 years at university, does his internship, another 2 years, is earning around 8,000 Rand a month.
Well, if you would want to put it that way, according to your exchange scales, but what we're pretty sure is that we get somewhere around 500 USD when all is totaled.
All right. Okay. Is government saying anything about trying to address these pay disparities? Because your counterparts here in South Africa are earning 5-6 times more than you. Are they going to meet you halfway at least, or what are they saying?
Well, according to the recently publicized bill, they were talking about these laws are in keeping with global standards. But then you tend to wonder, why aren't our salaries also being pegged around the global standards? Well, we have not really discussed to that extent with government in comparing with other countries. But however, there is no indication that, well, they would review upwards. From publications, from government officials, they've been saying that the previously Health Services Board, which is now the Health Service Commission, will be tasked with dealing with the terms of conditions for health workers. But then you realize these same guys in a rebranded commission are the same guys who received top of the range cars at the expense of an ailing healthcare system, and really do not stand up for the healthcare workers. So, and there would be nothing exciting about them or to look forward to the setting up of a health service commission, because they are just the same people.
What are you going to do about it? I mean, if you can only strike for 3 days, how are you going to press government to listen to your demand?
Okay, I think, well, we should put it on record that it is not our desire for us as health workers to have a protracted industrial action. We want to do what we know best, which is to help our patients to get back to the state that they were in. You realize that we are not related to doctors and nurses. We have relatives who are not in the medical field and who also suffer when these job actions occur. We are not going to stop to raise our concerns and issues to our government. It's our role as doctors to advocate for good healthcare system and good health delivery system. We've always wanted to negotiate with them and deliberate with them, and that will always be our first port of call. It has always been the government which has not been unwilling to get to the table with us, which has been the reason for the protracted job actions. We care for our patients, we care for our citizens, and we want to do the best for them.
All right, so this must be quite demoralizing for staff, and I just wonder how staff are feeling working under these conditions, not getting paid, and now having draconian laws being put upon them. Motivation levels must be quite affected.
Definitely, there would be at an all-time low. We realize that a lot of people, they are only left with finding a way out of Zimbabwe, and that is training more on our healthcare system, because we are losing a lot of skilled personnel who would offer more to our healthcare system, but are being snapped up by other countries. Because at times you realize that if you try to fight up, Well, we don't want to be fighting with our government. We want to be working with our government for the best of our healthcare system. And if you raise your voices and your concerns and they are not doing anything, what ends up is that you realize now if you do an industrial action which lasts more than 3 days, you could face a jail term and some fines, etc. You will get subjected to victimization. And at the end of the day, we lose that voice. We should be there in any democratic institutions so that we advocate for our patients as well.
All
And
right.
you end up giving up and say, well, there's nothing to do except
Yeah.
to get out of the country.
All right, we're running out of time, but I just wanted to get a sense of how many new health professionals are coming into the system each year. If in 1 year you're getting 4,000 leaving the country in just 1 year, how many new doctors are coming into the system each year qualifying?
Across all the universities that we have in Zimbabwe and others who are trained, who are foreign trained, I would say each year we have an input of around plus or minus 300, 350.
Wow.
Somewhere there.
So you cannot afford to lose 4,000 health professionals each year?
Yes, we cannot afford that. It's a very big burden on our healthcare system, which is already failing.
All right, Dr. Muzenda, we're going to have to leave it there. Thank you so much indeed for giving us some insights on some of the challenges that you're facing.
All right, thank you.
Thank you. All right, so challenging times for healthcare providers in Zimbabwe. So a doctor in Zimbabwe earns around 8,000 Rand a month, which means it's actually better for him to leave his job as a doctor in Zimbabwe and come to South Africa and work underground as a miner. That's the comparison.